Hi, my name is Chukwuemeka Nnuji. At the beginning of this project, I was the lead physiotherapist for the Redbridge Respiratory Service. On this project, my colleagues and I worked on redesigning existing treatment pathways of pulmonary rehabilitation input in Redbridge. These are my colleagues who were involved in this project. Our rationale for this project was long wait times to join pulmonary rehabilitation face-to-face exercise and education groups after initial assessment, high DNA rates, virtual pulmonary rehabilitation groups had stalled and was no longer active despite its earlier successes during COVID and lockdown. So we engaged our stakeholders, and after carrying out an audit around the problem and the data, as a team, we came up with an aim to reduce the number of weeks waiting for pulmonary rehab treatment after initial assessment in Redbridge Respiratory Service by 50% by the 31st March 2024. This slide shows the different drivers affecting our aim that led to our change ideas. For this project, hybrid pulmonary rehab is our change idea. Hybrid pulmonary rehab is a blended model consisting of both face-to-face and virtual pulmonary rehab combined as a new treatment option for our patients. Here is a chart that summarizes everything we did on this project. Patients were waiting for an average of 10 weeks to join pulmonary rehab exercise and education groups after their initial assessment. The first PDSA over here shows when hybrid was first introduced. Lots of variation can be seen. The second PDSA here is still the original PDSA, but tweaked with the addition of admin processes. We started to see improvements in the process to the point where we had to recalculate our control limits. The third PDSA was due to the introduction of a new face-to-face pulmonary rehab venue that was accessible to patients in BHR collectively. These three round dots here indicate data points that went above our control limit for one reason or the other. As you can see, we've achieved sustainable improvement. Our wait times had reduced to just under 2 weeks. This slide is a chart showing only the hybrid pulmonary rehab and its impact in the process. This other chart here is showing us something we did not expect on how it affected the DNA rates. This is our balance measure. Before hybrid PR was introduced, DNA rates was at 23.81%. And now with the introduction of hybrid PR, we were able to get a reduction to 9.23%. There were successes as well as challenges. Some of the successes included wait times to join pulmonary rehab groups reduced from 10 weeks to 2 weeks, DNA reduction by 15%, and we achieved more than 80% from our original 50% aim. Challenges were resistance to change, we struggled with low staffing levels, and also the technology savviness required for virtual and hybrid PR processes. Here are some of the lessons learned. For me, I would emphasize more on always referring and engaging with your stakeholders throughout the process. For the next steps, we are still collecting data. Currently, we have introduced this model to support Haven and soon to be applied for Barking and Dagenham. We are looking at ways to digitize some of our admin processes. We are looking at cost savings, which brings me to the next slide on impact. Approximately 10 to 15K pounds saved from reducing DNAs. Patients are more satisfied with our input due to timely access and early intervention, reduction in health inequality with less wait times and more accessibility for our patients, improved sustainability and expansion of this project to support BHR-wide, and carbon footprint reduction in our service delivery. Talking about carbon footprint reduction, this project has enabled decreased vehicle emissions by saving CO2 emissions of about 1,984.84 kilograms of CO2. Just to put it in context, saving this would be like avoiding boiling a full electric kettle of water about 92,242 times. It's also like avoiding nearly 4 round flight trips between London and Rome. Lower energy consumption by saving CO2 emissions of approximately 400.4 kilograms of CO2. Saving this would be like avoiding boiling a kettle full of water 20,020 times, which is also equivalent to avoiding 4 one-way flights between London to Paris. Decreased paper usage by saving CO2 emissions of about 188.76 kilograms of CO2. There are other areas that would be difficult to calculate due to specific data needed. However, they are all potentially areas that we can also see a reduced carbon footprint. For example, lifestyle emissions for equipment, the impact of behavioral changes as a result of moving to hybrid PR option, and then emissions saved from reduced traffic congestion. To summarize, this project has effectively reduced waiting times and DNA rates for pulmonary rehab treatment in the Redbridge Respiratory Service, while significantly cutting CO2 emissions by 2,574 kilograms of CO2. Thank you.